Hi guys, going live, Wednesday's lesson of the day. Today is January the 18th, and we had a lovely coincidence of things happening today. It comes in threes, and it started this morning, coincidentally, talking to Jennifer Hollander, our amazing nurse practitioner here at Beverly Hills Center, and she brought me a photo of a patient that she had seen initially for lines in the neck, and she did the treatments that we do very, very well. And I asked her, you know what, I've got a feeling this would be a good lesson of the day. And as soon as I said that, I thought, how great would it be if I saw patients today and a bunch of them brought it up. And guess what happened? Lo and behold, I saw, I don't know how many patients today, a lot. And it came up 3 times, the horizontal lines. What do I do about the horizontal lines? This is what bothers me more than anything. I've tried everything. So that's what we're going to address today, is the horizontal lines of the neck, which you can call horizontal rhytids, which just means horizontal wrinkles, which are the horizontal lines in the neck. You can see these guys right over here. Why do they happen? There are articles describing lymphatic drainage basins that go across that area that cause the depression, but realistically you consider it sort of like a stretch mark where the head bends like this and that, and when it bends like that, it needs an area to fold into, and what happens is the dermis that's behind it doesn't form so well. So it's an area that has a thinner dermis and hypodermis, mainly hypodermis, so there isn't much behind it, but the epidermis is typically normal. With exception, there are some people who actually get hyperpigmented there because of the folding over there if they are a little bit more overweight, so you can get actually epidermal changes as well. So what do you do about this? The things that you have to think about: number one, there's a bit of an accordion effect in the neck, which compresses the lines and puts weight on them like that. And then even if you stretch, you have the lines that are ingrained within. So to get rid of the accordion function, there's 2 things that you can do. One is lifting. So you do a neck lift or a face lift, and that'll improve them pretty dramatically. If you look at the lines from the Aura lift that I do or the weekend lift on the website, you'll see that they dramatically improve, even though we haven't improved the quality of the skin within. The facelift and neck lift is the number one. That's the biggest thing. And I tell people, and I've told people today several times, realize a facelift will make your skin look better, but does not improve your skin quality. Do you understand the difference? And they kind of don't usually understand that, but once you lay it out, you say, it makes the skin look better because you've lifted it, or reflects light better, and doesn't have as much shadowing or as much crepiness or accordion effect. The other thing that we have to consider is actually the quality of the skin. The quality of the skin or the dermis itself changes over time. Some people become thinner in the dermis and stretch out. The collagen, elastin, hyaluronic acid, all the soft tissue elements or proteins tend to change with age. And the whole basis of doing lasers and radio frequency is to achieve some sort of remodeling and renovation within those areas. You actually call it soft tissue remodeling. And you do get benefits that way. So number one, you can do lifting to improve those kind of things. Number 2, a really nice thing to do is radio frequency. Radio frequency, there's a million different ways to do it. There's wand-based devices where you can actually go and melt fat. That's not meant for this. The best one is going to be Profound, followed by Matrix, followed by Morpheus. These are the 3 best needle radio frequencies for actual skin tightening. They don't work well for stretch marks, and although I said this is an atrophic type of skin, it still works really, really nicely and thickens up the area. So that's the number 1 thing that I recommend to patients to improve the skin quality, is to do that, to do profound radio frequency. If they're doing it at the same time as surgery, you can do nanofat and PRP injections in there. That actually rejuvenates it a little bit more. What Jen Hollander did in this case that I'll show you here is she did profound and then waited a few months, went back and did a little bit of dilute hyaluronic acid filler so it doesn't get lumpy, and then placed, didn't do Botox, but sometimes we do neurotoxins. So let me show you that, and I'll tell you what not to do. So here's the before, and you can see the horizontal lines in the neck, and you can see how the chin's pooching over there too. So it's really cool that, boom, that's the after. This is not a surgery. This is a radiofrequency skin tightening. There's a question that says, did I say Morpheus will not work for stretch marks? No, they can work for stretch marks, and the FDA indication for the 1540 laser, for example, which is a non-ablative, is actually for stretch marks. They just don't get big improvements because it's an atrophic skin that doesn't have much dermis, and if you don't have dermis, it's really hard to improve with tightening because epidermis only contracts immediately with heat, doesn't get long-lasting results. Dermis is what gives you the long-lasting improvements. So here you can see Profound really helped. The lines over there, it looks like it's lifted, although it is not. And you can see the lines are getting lighter. Usually I tell patients that you get a 30% lightening from Profound itself, and that happens for a few different reasons. One is the skin tightening or dermal thickening effect of new collagen, hyaluronic, and elastin. The other is the hyaluronic portion, that you're actually retaining more water, and the more fluid you have in the skin, the brighter it looks, the less of a shadow it throws. So they actually look lighter for that reason. So I do love this treatment, Profound, followed by either filler into the lines. We do a dilute or softer filler. The more linear fillers like Restylane Refine work beautifully in there. And then you can always do a neurotoxin like Botox or Dysport, Xeomin to relax the skin pull that's happening, not just around the platysma, but within the little reticular fibers that are on the bottom of the dermis. There's some myofibroblast thing that improves. I don't fully understand how it works, but it works. The things that I recommend against is trying to form collagen by injection. So the way that works is people inject Radiesse or hyperdilute Radiesse or Sculptra, and they think that it's going to form collagen in the area just like a radiofrequency would, and that's incorrect. It's a different array of collagen formation that is like fibrosis. So you can cause little fibrotic changes, which can stiffen the area, and you can actually get calcific nodules, which means you can get little calcium deposits and nodules. I don't like that, not because it doesn't fix the righted in some cases, but because it can have issues. You can get, RSNY, dollars, my old friend. So you guys got to listen to RSNY, the best hip-hop reggae band ever. They're fantastic. So back to what I was saying. The calcium hydroxyapatite, the hyperdilute Radiesse, the Sculptra, yes, they form collagen, but it's not really the collagen that you want. So I don't like depositing it in there and possibly causing little calcific nodules that you have to soften later. When you have other options, you can do the filler that I showed you. You can do radiofrequency. You can do Botox. So why do it if you have the other options? I don't fully understand that. So I do recommend staying away from those and just using regular fillers. It's fine. And these improvements do last a while. They're not in themselves impressive. So I've had injectors ask me before, like, do I like doing the filler or the Botox in there? I say, you know what? I'm not that impressed with it. It works. It just doesn't last so long. But when you do a combination treatment where you're doing radiofrequency and you're doing the filler Botox in there, or you're doing the nanofat PRP, then I think you get a nice combined result. So understanding this, it is like throwing everything and the kitchen sink at these horizontal righties, and that's when you get the best improvement. So if you want the best improvement, there is lifting, there's radiofrequency, which is again going to be Profound, Matrix, Morpheus. Those are the three best. Profound's the most substantial. Matrix second, Morpheus third, but they're all very good for it. But Profound definitely gives you the biggest result that I've seen with these things. You can lift, you can do that. You can do the injection of nanofat PRP, you can do filler Botox. Now the last thing, if somebody is obese or overweight, now you're dealing with a deepened channel with no hypodermis that comes across there, and then you have two chunks of area that have a big hypodermis or fat layer that comes across there above the platysma. So you can actually go and do liposuction to lighten it. And if you want the best result, you do on those patients who are a little overweight, in the heavier folds, you go down and do liposuction, then you do the radiofrequency. And if they're darker skin, they may have hyperpigmentation, so black patients often do. And what I do with them is I actually inject that area. You don't just use hydroquinone or kojic acid, which you can use. You also use TXA, tranexamic acid. So tranexamic acid is a medication that's used for women with heavy periods or heavy menstruation. I don't talk about periods much, so I'm not good at explaining exactly what it is, but I'll tell you, they use it for that. And we found that you can also use TXA or tranexamic acid for melasma or hyperpigmentation. And there's only certain types that it'll work for, but it does work. So I've injected intradermal blebs all across, and you see pretty rapid improvement, meaning within about a week, which is, I don't know how, I mean, I get the science behind it, but I'm still shocked that it works. Works very nicely. It's very safe. There's no limitation on how much you can inject, and you just do it like once a week, once every 2 weeks, and you'll see it'll start lightening. In addition, yes, you can use all the other stuff if you want to, but that's I'd say the easiest is doing the TXA. Fantastic. Oh, Adam Lambert, miss you, buddy. So that is all. I hope everybody understands that and sees that you could get such a nice big improvement from just doing that. So that's profound. A little bit of radio, so that's radio frequency plus a touch of Botox. Touch of filler that's dilute. You can do non-dilute as well if you have a thinner one like Profilio. Profilio would be amazing in those things, or the lighter RHAs that they have would be fantastic for that. Let's see, should we answer a couple questions here? Please tell if Botox works for the neck. Botox works a few different ways for the neck. One is platysmal banding. So if you have descent from the lateral face, the platysmal bands start to hang more midline like that instead of being drawn all the way across. My neck looks kind of fat. That's sometimes improves with Botox. Not very long lasting, not super effective, but it helps, especially people who strain a lot like that. So you can Botox directly into the bands and it relaxes it. The other option is something like a Nefertiti lift, where you're doing microtox injections all the way around. Microtox is a form of light neurotoxin injection coined back in, I think, 2011 by an Asian group. I can't remember their names, but they did microtox. And you can just do it kind of all the way across. And it does actually give you a little bit of lift around the jawline because the platysma doesn't pull down as much. It kind of tucks up. So it's kind of cool how it works. Otherwise, not a super impressive result from neurotoxin. It's just, again, one of those additive things that you can do. Threads, they don't work for this stuff so much. You can throw 1 million in there and you're trying to build collagen in the same way that Sculptra and Radiesse does. It is not the good kind of collagen. It's not the kind that you want to exist in your dermis. The only kind that can replace that or reorganize it properly is going to be like a good radio frequency that's done at a medium, gentle level, not a very hard level that's going to damage everything to the point of not improving. Thoughts on FaceTite? FaceTite is a good device for somebody who has a fattier neck. FaceTite's not meant for the face. It's meant for the jawline and neck. And you use it to lipo the fat, and then you get some heat contracture with it. It does run a little bit higher risk, especially at higher temperatures. So it's important not to go too crazy for that. You can get ulcerations and indentations just like you can with the other wand-based devices like Thermi RF. So you have to be cautious with those. Doesn't mean don't use them. They're great devices to use, especially if you have a fattier neck. Fantastic. Can you please explain the areas for Profilio? You mean Profilio would work great in somebody with a crepey neck, so who's very dehydrated, and you can use the thinner concentration Profilio, or you can use into the lines over there, and some people can do down over here in the upper chest. Do you have a girlfriend? No. Is 50 years old a good candidate for a facelift? Fantastic. But it's not age dependent. It's more mechanical. You have to see if that's what's needed. What about Morpheus 8? We talked about that. I think it works nicely. Do I do revision rhinos anywhere? Nope. I can't. Is Profound good for jowls and a bigger double chin? It is good. It is not a cure-all. It does help the jowls. It tightens them a little bit. It does tuck the chin a little bit. It's not incredible. It's just great. It's really, really nice to use. Again, threads, do they build collagen? Yes, but not the good way of collagen. Not the healthy kind. It's more like the Sculptra kind, but it can be used to your benefit for people who are very gaunt. Is microneedling good? Microneedling is fantastic and does, especially for these areas, hydrate them and make them a little better. What about Fraxel? Fraxel on thin, light skin that's super stubborn. There are thin, white skin that's super stubborn. Fraxel is good for that. So you can actually do that for those patients. Can't wait for Eturn to open. Me too. It's coming. Profilio is not available in the US. I don't think so, but people have it because I know some people in Miami have been using it, but I think they just bring it in on their own. Thermage opinion. Thermage is, yeah, I've said it before about like Ulthera. It's like you're in the year 2023 and you're still using the original like Macintosh computer that had the floppy disk. And so I advise against, Thermage. Thermage and Ulthera. Those are antiquated. I think we can get a lot better ones. Give me a smile. Fantastic. Does Botox do this? Great. Have I used tranexamic acid for dark circles? TXA for dark circles, no, not so much if you're talking about under here. However, if somebody does get hyperpigmentation from a treatment or post-inflammatory hyperpigmentation, you can use it for that. Filler, direct line in the retrograde technique, or fanning. So in this area, it is needle injection retrograde. That's the best way to go for superficial creases and lines, most controllable. And if you get a bleb, realize that you can't massage it out because it's their neck. You're choking them if you start pushing it. So you have to get it in between your fingers and pinch like this if you want to massage it, or you poke it with a needle and try to extravasate it. Profound for over 60. Yeah, of course. Any fat loss, any heat treatment, including CO2 laser, can cause hypodermal fat loss either through the mechanism of fibrotic reaction or fibroplasia. You can actually get fat loss and fibrosis, or it can happen from the heat dispersion or from killing the dermal plexus. So any of those can cause it. Profound if it's done properly, meaning at 67 degrees Celsius and 3-second pulse duration. And you don't do too many passes. So for the whole face and neck, you use like 250 to 350, you're fine. You're not going to get any substantial fat loss that you would ever notice. However, if you do 600 passes thinking that more is mo better, I said it before, it is not mo better. It makes things worse. You're not going to get a reaction. I had a patient today, coincidentally, who had some laxity here, who's a doctor, and she's going to go back home and do the treatment. And I said, you're going to have the temptation as a doctor to tell the person doing it on you to run more passes here to get a better effect. Don't do it. If that were real, you would have done it for the whole face, thinking more passes is going to be better. It is not. At some point, you end up deflating and you don't rebound to heal as well. So when we're doing laser treatments and radio frequency, we're damaging the healthy face with the hopes that it's going to recover and replenish with new soft tissue elements or proteinaceous elements under the skin. We're hoping that it does. We're hoping that someone heals normally. What you don't want to do is denature somebody so much that they can't heal from it. So that's what happens when people do too much CO2 and they say it deflated my face. They do too much Ulthera, they say it deflated my face. You want to avoid that. More is not better. And I think that's a lot of questions. What can you do? Blah, 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 blah. Tamara Elkins, long time. Saludos de México. Saludos a ustedes. Tipos de frecuencia para el cuello. Y ya hemos hablado sobre eso, y la radiofrecuencia que a mí me gusta más que los otros es Profound, que no tiene en México, solo tienen Morpheus. Pues eso es el segundo y lo puedes usar sin problema, pero tienes que hacerlo más que una vez. Tienes que repetirlo 3 o 4 veces. When will you return to Dubai? I don't know, but not too long, because we're going to open a Cupid Lips over there. And I think we got it. Oh, here's a good one. Thoughts on Ellacor. Oh, I've talked about this before. I have a Wednesday lesson of the day when I was in the car with my friend Jonathan Chiban, Food God. He's legally changed his name, so it's actually not Jonathan Chiban anymore. It is Food God. And I was talking about Ellacor, and he's in town now, but he hasn't called me to have dinner, so it's strange. We'll talk about that. And Ellacor is an interesting device. And I don't want to insult the person that developed the device or had the idea for the device, but I will insult anybody who buys it, uses it, talks about it as though it's a good thing, or that other better options don't exist, because they just don't understand reality or realistic risk. They're cowboys. So Ellacor is a device whereby you put a million little tiny punch biopsies, pretty much, or punch excisions in the skin, and you're trying to remove the effective overall surface area of the skin to contract it and make it tighter. And while this does work, it carries a lot of risk because you're putting a lot of holes in the skin that need to heal, and skin goes through different phases of healing. And different skin types go through different phases differently, which means if you know about skin healing, you know you get primary closure, you get some thickening, then you get some thinning, then you get inversion, then you get rebound. You get all these different things that happen with skin healing over time. And if you have porous, sebaceous skin types, they're going to indent permanently. They're going to form pores. They're not going to come back out. They get thickened around and they get atrophic in the middle, and that's acne type skin and anything in that realm, or patients with a lot of pores, they do that. Thin, light, white skin, like a 90-year-old with the thinnest skin ever, will do great with this technique. Fantastic, but nobody else will. Everybody else is going to have problems with marks here and there and discoloration and indentations, and they're things that you can't fix. Now, if somebody's promising you $20-30 billion saying, I'm going to give you this treatment and it has a 5% chance of doing this to you, you might take it. If somebody says there's a 5% chance of this or even 1%, but this other treatment called Profound will get you the same result without causing that risk at all, you'd have to be kind of crazy. You'd go for Profound or Morpheus or Matrix. So Ellacor has not produced results that I've seen that are greater than Profound. It's possible they exist. I haven't seen it, but I have seen tons of complications. The first month or two it came out, I saw like 5 patients in my office already. So not to rant about it, I've already talked about it before, but since we're on the topic of neck, there are better options. So not that it doesn't work. I'm sure it does work, but it carries some risk, and it's unnecessary to take on that risk because you can use another device that'll get the same result or very, very close or better sometimes. And you can do it on the face too. So you can actually use Profound on the face, whereas Ellacor you're not supposed to, I think. I don't know. It'd be crazy to do it. Yeah, I don't like that idea. So what would you recommend for acne? There's active acne, which we use Oviclear. It's the best thing ever. It actually can shrink the sebaceous glands. And then we have a bunch of stuff for old acne. What is done for acne? Ooh, popular. All right, well, I think we talked about that one before. King Rosie, Vem para o Brasil. 100% very soon. Muito soon. All right. Do you recommend Tuck Daddy? Yeah, love him to death. He is the best. TMZ, pros and cons. TMZ is a great channel that tells you the news before anybody else does, so it's really only pros. Can you treat serongomas around the eyes? Yeah, dermatologist usually likes to do it so they can fulgurate those things. And does Retin-A help with saggy neck? Typically no, but Definage can. Definage is an interesting one that people use, and it's a little nice. When am I going to return to Monterrey? As soon as they invite me. Me tiene que invitar otra vez, porque ya extraño a Monterrey. All right, there we go. Pues ya está. Gracias a todos por su atención. Y I hope everyone has a good night.